Hi everyone, in this video I'm going to discuss about the procedure bronchoscopy. I'm Julian K. Thomas, faculty working in Triple M College of Nursing. The objectives of this session include the group should be able to define bronchoscopy, enlist the types of bronchoscopy, list down the indications and contraindications of bronchoscopy, brief the nurse's responsibility in bronchoscopy, enumerate the complications of bronchoscopy. Bronchoscopy. So, bronchoscopy is a procedure in which an examination will be done on the lungs and the air passages. So, bronchoscopy is an invasive procedure that permits the direct examination of the larynx, trachea, and bronchi using either a flexible fiber optic bronchoscope or a rigid metal bronchoscope. Types of bronchoscopy. So there are two types of bronchoscope used as we discussed earlier, flexible fibro optic bronchoscope or a rigid metal bronchoscope. So what is a flexible fibro optic bronchoscope? Fibro optic thin flexible bronchoscope that can be directed into the segmental bronchi. Because of its small size and the flexibility, it allowed increased visualization of the peripheral airways and it is ideal for diagnosing any pulmonary lesions. Usually, this flexible fibro optic bronchoscope is performed under local anesthesia. The second one is a rigid bronchoscope. As the name mentioned, it is a metal rigid bronchoscope. It is not flexible. It is a hollow metal tube with a light at its end. It is used mainly for removing foreign substances, investigating the source of massive hemoptysis, or performing endobronchial surgical procedures. So, usually, this type of bronchoscope is used in the operating room and not at the bedside. So general anesthesia may be required while we are using a rigid metal type of bronchoscope. Indications of doing bronchoscopy. So bronchoscopy can be done either for a therapeutic purpose or for a diagnostic purpose. So what are some of the therapeutic indications for doing a bronchoscopy? Removal of excessive secretions or any mucus plugs or benign or malignant tumors to clear the airways. If any thick tenacious mucus is present in the respiratory tract which is very difficult to take it through suctioning, a bronchoscopy can be done to remove the secretions. A removal of any foreign objects or any other obstructions in the respiratory tract. Control of bleeding in the bronchi, or it can be used as a palliative care for laser therapy or radiation therapy for the bronchial tumors. So these are some of the therapeutic indications of bronchoscopy. Coming to the diagnostic indications of bronchoscopy, how we can diagnose certain problems in the respiratory tract. So for that also bronchoscopy can be used. Direct visualization of the tracheobronchial tree for any abnormalities such as inflammatory process or any tumors or any strictures. So if we suspect any problems in the respiratory tract, to have a more clarifications on that, we can have a direct visualization of the respiratory tract using the bronchoscope. Direct visualization of the larynx to determine the presence of a vocal cord paralysis. Then also we can use this as an aspiration of specimen for culture and sensitivity and for cytological examination. Cytopathological examination, and also we can take a small amount of tissues or fluids can be aspirated and taken and sent for laboratory examination, and biopsy of tissues from the suspected lesions. So these are some of the diagnostic indications for bronchoscopy. Contraindications. Contraindication means when we should not go about with bronchoscopy. If the patient is uncooperative, the patient is not cooperative to do bronchoscopy. Patients with uncorrectable coagulopathy, if the patient is having any blood disorders or clotting disorders, then we should not go with bronchoscopy. There are chances of bleeding. Patients with severe acute respiratory failure with hypercapnia who cannot tolerate high flow oxygen interruptions, and then severe tracheal obstructions which make it difficult to pass the scope. history of recent myocardial infarction or unstable angina, or any history of head trauma who are prone to develop or prone to increase the intracranial pressure. So in this kind of patients, we should not go about with bronchoscopy. Bronchoscopy. So what are the nurse's responsibilities in bronchoscopy? So pre-procedural, the doctor who is going to do the procedure should explain the procedure to the patient, and the nurses should make sure that the informed consent has been signed. So obtain medical history from the patient, a thorough history of the past medical history, present surgical, and all history should be collected from the patient. And make sure that the patient is in NPO status for 6 to 12 hours. Mostly we'll keep the patients for 8 hours. Then monitor the vital signs thoroughly, provide oral hygiene, remove any dentures or any partial dentures or removable bridges that should be removed from the patient. So while inserting the bronchoscope, there is a chance for falling into the, it will obstruct the low respiratory tract. So we should remove the dentures. Also, in the pre-procedural phase, we should ask the patient to stop the blood thinning medications. Some examples are aspirin, clopidogrel, or warfarin. Several days prior to the procedure, that is usually 4 to 7 days prior to the procedure, we'll ask the patient to withhold blood thinning medications, administer preoperative medications as ordered by the doctors, prepare for local anesthesia. A numbing medications or an anesthetics will be sprayed on through the throat so that the patient will not have any feelings when the scope is introduced into the respiratory tract. Relieve anxiety because the patient will be anxious about the procedure. Explain the procedure and provide comfort to the patients. Prepare emergency resuscitation equipments at the bedside. So if it is a flexible type of bronchoscope, we can do the procedure at the bedside, but it is a rigid metal bronchoscope, we have to do it at the operation site. So based on the area where we are performing, the resuscitation equipment should be kept ready. So during the procedure, the bronchoscopy, first the patient will be prepared. Once the patient is on the table, apply local anesthetics, spray the local anesthetics onto the throat so the patient will have a numbing feeling. So while inserting the bronchoscope, the patient will not have any discomfort. So then we have to insert the bronchoscope. If the patient need additional anesthetic, if the patient find it difficult or the patient had any discomfort or pain, then additional anesthetic can be applied. Then examine the area using the bronchoscope. A camera will be there at the tip of the bronchoscope. So with that camera, we can visualize inside the respiratory tract. So if it is a diagnostic method of doing bronchoscopy, the required tissues or specimens can be collected using the bronchoscopy. So during the procedure, what is the nurse's responsibility? Position the place the patient in a sitting or supine position and provide supplemental oxygen as required, and always connect a patient to the monitor. Always monitor the patient's vital signs should be monitored throughout the procedure. Provide assistance with diagnostic procedures or treatment. And once the specimen is collected, secure the specimen, label the specimen, and it should be sent immediately to the laboratory. So once the procedure is over, make sure that the patient is comfortable. Assess for any bleeding episodes. Assess the respiratory status of the patient. Monitor the vital signs. Position the patient. Then reinforce the patient is able to take diet. So when we can give diet for the patients once the procedure, we have to check for the gag reflex. So once the gag reflex is returned back, then we can start giving feed for the patient. So relieve anxiety and provide comfortable measures. Assess for gag reflex. Instruct to avoid eating or drinking for approximately 2 hours or until fully awake with intact cough and the gag reflexes. So once the patient has returned with the gag reflex and the cough reflex, then the patient can have anything orally. So what are some of the complications associated with bronchoscopy? So the major complications like bleeding from the site of the biopsy, fever, hypoxemia, laryngospasm, pneumothorax. So minor complications are sore throat, hoarseness, cough, or muscle ache. So these minor complications usually will be there for the patients when the patient undergo a bronchoscopy. What are the findings associated with bronchoscopy? So, what are the normal findings we can identify while doing a bronchoscopy? The normal findings will be the bronchi structurally same with trachea, right bronchus more vertical than the left and slightly larger, smaller segmental bronchi branching off from the main bronchi. So, this is a normal findings. So, what are some of the abnormal findings we can elicit while doing a bronchoscopy, which include the clinical findings of any pulmonary diseases. If the patient is having any pulmonary problems or respiratory disease like tuberculosis, interstitial pulmonary disease, bronchogenic carcinoma, or other fungal or parasitic lung infections can be identified with the help of bronchoscopy. Or any foreign substance in the trachea or bronchi, example like mucus plugs, blood stones, or any foreign objects in the respiratory tract can be identified with bronchoscopy. Then endotracheal abnormalities such as narrowing, stenosis of the trachea, compression, ectasia, that is dilatation or distension, irregular bronchial branching or abnormal bifurcations due to diverticulum. Then bronchial wall abnormalities such as swelling, inflammation, ulceration, tumor, or protruding cartilages. So these are some of the abnormal findings we can elicit during a bronchoscopy. So, to conclude, a bronchoscopy is an essential tool for clinicians or the healthcare providers treating patients with lung disease. So, bronchoscopy is a procedure where we can identify any abnormalities related to respiratory tract. So this is a safe procedure for the majority of the patient and a useful tool for both diagnostic and therapeutic purpose. So the patient will require constant monitoring before, during and after the procedure. The nurse must look for any changes in the breathing pattern, chest pain or any other signs or discomfort. So complications, sometimes it can occur very, sometimes it will be minor or self-limiting. So always we should instruct the patient if the patient has any discomfort like fever which lasts more than 24 hours, or if the patient is having any increasing chest pain, or if the patient is having any difficulty in breathing, or if the patient is having any cough more than 2 or 3 days after the procedures, immediately the patient should visit the clinician or the doctor who is consulting. So, appropriate preparation and close supervision and adherence to the protocol were essential for a successful and safe procedure. These are the references. Thank you.